There is a new warning this morning about invasive group A streptococcus. A mother in Kitchener, Ontario, is urging parents to be on the watch for symptoms after her 5-year-old daughter died of complications from the severe infection. Officials in Ontario confirm they are seeing a major increase in cases of strep A. They're not the only province, and Canada is not the only country. Albert is on the story. Albert Delatala, let's begin with what we're learning out of this Kitchener story and this family's loss, Albert.
Sure, Heather. So the mother of 5-year-old Quinn Henderson is speaking out to warn parents about the potentially deadly consequences of a rare form of a common bacteria. Christina Hectus's daughter died of complications from invasive group A streptococcus at the end of March. Quinn had been home from school with a cough and fever. Hectus says no one picked up on the fact it could be anything other than a bad cold. Here's more from Quinn's mother.
I did everything that I was told to do. I called the doctor. I called 811. I did all of those things that a mother or a parent would do in this situation and was told multiple times, it's not necessarily needed. I don't ever want somebody to have to feel like they didn't do enough for their child like I did. I don't blame anybody because blame doesn't do anything for anyone.
When Quinn's parents decided to take her to the emergency department in Kitchener, Ontario, they say she was admitted in less than 15 minutes and put on oxygen, given IV fluids and antibiotics. Doctors took x-rays and drew blood. She was diagnosed with pneumonia, transferred to a hospital in Hamilton, Ontario, where she was found to be septic from invasive group A strep in her blood. Quinn died just 12 hours from when she was initially admitted to the ER. Her death comes as cases of invasive strep A appear to be on the rise. In Ontario, where this took place, the 5-year average before the pandemic was about 550 cases over the cold and flu season. This flu season has seen about 900 cases, a more than 60% increase. Quebec has seen similar increases, as well as have other countries around the world.
Albert, thank you very much. Albert Delatala with more on the Kitchener situation. It's going to be the basis for our conversation this morning with Dr. Christopher Labos, who's an epidemiologist and cardiologist, and I normally say, and he's in Montreal, but look who's with us in Toronto today. Dr. Labos, thank you for coming in, and nice to see you in person.
Nice to see you in person, too.
I have viewer questions for you and plenty of my own questions about this. We have talked with Dr. Labos over weeks and months about strep A and particularly this invasive form, but given this Kitchener story, thought it's time to bring it forward again and just to remind parents of what to watch for. So what are we dealing with? What exactly is invasive group A streptococcus?
So streptococcus is a bacterial infection. So most streptococcus infections are not severe. They're very mild. They cause something like strep throat, and most children get over it. But sometimes it can cause a more severe infection. It can infect the skin, cause deeper infections, and if it enters the bloodstream, it can cause sepsis, and it can be fatal. Invasive group A strep, once it gets that severe, has a fairly high mortality rate, somewhere between 30 and 50%. So it can be a very serious infection if it's not treated promptly with antibiotics.
As you say, it can be fatal. We've seen children who have passed away, not just in Canada, but around the world. Cases globally, cases nationally, have really increased quite dramatically this year and since the level they were pre-pandemic. What is behind that increase?
Well, I don't think anybody really knows for sure. We saw first in the UK and then globally that starting in late 2022, extending into 2023, there was a real increase in group A strep. And nobody really knows why. Was it a consequence of the pandemic? Were there other factors at play? There's still a lot of uncertainty. We usually do see an increase in group A strep during the winter months, and we saw very little of it during 2020 and 2021. Because people were practicing public health measures, wearing masks, kids were staying home from school. So it's really unclear, was this a consequence of the pandemic, or is something else going on that is causing these cases to go up? And I don't think it's very certain.
Okay. You know, when you said when it becomes invasive, this bacteria gets into places that it shouldn't be. Doctors know what to watch for. Doctors know what they're dealing with in these cases, but obviously parents don't always recognize the signs. That mother in Kitchener thought she had done everything that she needed to do. So let's give some information to parents specifically. What to watch for in terms of when things are starting to be particularly concerning.
I think the major thing is if there's a doubt in your mind, if you ever ask yourself the question, I wonder if I should go to the hospital, you should probably go to the hospital. So if your child has a very, very high fever, like 39 and above, let's say, if they're struggling to breathe, if they're not doing well, if they're not keeping food or liquids down, I mean, those are not good signs. Most strep throat is going to be okay, especially if you can get antibiotics early. But if your instinct is telling you something's not going well, honestly, you should go to the hospital, because there's no real specific sign that's going to tell you this is an invasive group A strep. It may start mild and become more severe very, very quickly.
Well, that raises a point. If you go to the hospital because you're concerned about something unusual, do you then push immediately for a strep A test and say, you know, given everything that's going on, should we be tested for this right away?
I mean, you could certainly mention it. I would be shocked if most doctors didn't know that with everything that's going around, because I think a lot of us have anecdotally seen a lot more group A strep, and they would know doing a strep, you know, swabbing your throat for strep is a fairly simple thing. It would probably be pretty much one of the first things that would be done at the hospital anyways.
Okay. I'm going to put a pause on my questions. I have 3 really good ones from viewers. This from Quebec. You know, we're talking about this newly presenting now in increased numbers, but this is a case that goes back years, talking about this viewer's youngest child who had symptoms chorea at the age of 7. What is that and how is it related?
So that's a movement disorder. It is a complication of strep infections in the same way that rheumatic fever is. Yeah.
Okay, so this child had symptoms chorea at the age of 7. At worst, she couldn't walk and had difficulty speaking. Was treated in hospital, Montreal Children's Hospital, and thankfully she made a full recovery, although she carries heart damage as a consequence of the disease. So this person is wondering what treatments have been developed in the last 23 years since their experience, and if any preventative measures exist.
I mean, well, the most important preventative measure is treat the strep. If you get an early treatment with antibiotics, the reason why we don't see symptoms chorea that much anymore and we don't see rheumatic fever that much anymore is because we use antibiotics. We treat the infection early. In terms of treatment, a lot of it is just immunosuppression. So what's evolved is the use of things like IVIG to sort of treat the problem. And so...
What's IVIG?
Intravenous immunoglobulins. So you can treat the complications, and usually it has a very good prognosis, and usually children recover. And so the treatments have evolved a little bit, but the main thing is prevention and treating the infection early with antibiotics.
It sounds like if it is detected early, the treatment is pretty simple.
It's antibiotics. Yeah,
that's it.
That's
okay.
It.
So we need to get recognized first and get on that treatment regimen. A question from Jane. This is also about evolution. Jane wonders, have strep A variants evolved, having fewer typical strep A symptoms? And she gives a long list of, you know, the voice, the tonsils swollen, the tonsils being inflamed, the tiny red spots on the roof of the mouth. She's obviously someone who has an experience with the symptoms of strep A. Have there been variants that have evolved, Dr. Labos?
It seems no. When you compare the 2017 outbreak in the UK to what was happening now in 2022, there was no change. It was the same bacteria. It's not like COVID where we had new variants all the time. So it looks like it's the same infection. It's just that younger children do tend to have sometimes more atypical presentations. That's why people might be seeing not quite typical cases and not being sure if it's strep until you actually do the swab.
Okay, Jane, thank you very much for that. Finally, from the viewers, Valerie writing. Valerie is 59. She says she's had a crackling bad cough for a week now with yellow phlegm, and her doctor dismissed it as a viral infection. She's wondering if this should have been treated as a bacterial infection, not taken so lightly, perhaps, in the face of what we're seeing with strep A right now. So a little bit to address her specific concerns, but I'm also wondering, we're talking about this in children. Invasive strep A in adults. Is it existing? Does it present in the same way? Can we tackle all of that for Valerie's question?
So it could be. I mean, a bacterial infection needs to be treated. The rationale for treating people with antibiotics is, number one, it lessens the severity of symptoms. It lessens the course of the disease. It also prevents transmission. So if you get treated with antibiotics, you're no longer infectious after about 24 hours. So there's a lot of good reasons to treat people and treat people early with antibiotics, if it is a bacterial infection, though. And so if there are signs of viral infections, usually yellow phlegm, we tend to say that that's not a bacterial infection, it is more viral. And there are other signs that could lead you to think that it's more viral. If you have like a runny nose, red eyes, that tends to be more viral
Which
symptoms.
Which is exactly what her doctor picked up.
Exactly, so that's the thing. So if you think it's viral, antibiotics are not going to help. So you want to treat early, but you also don't want to overuse antibiotics, so that leads to antibiotic resistance and a whole different slew of problems.
How do we prevent even getting strep A, catching strep A? I mean, how do you catch it? Washing our hands?
Washing your hands.
Back to that again.
Really, one of the more simple things, and early treatment. So if you had an outbreak, let's say in a daycare, treating the children early, you're not going to be infectious after 24 hours. So treating the children early is going to minimize the amount of time where they could potentially infect others.
Thank you. Thank you very much. Thank you to our viewers for the questions. Thank you for the answers in person, no less. What a treat. Dr. Christopher Lavos, we'll see you next week, and thanks.
Talk to you then.